Hi, my name is Samantha, CEO and owner of TOTLbill, and I'm really lucky today. I have with me special guest Ani Anderson. Ani is the CEO of New Health and the Director of Operations at the Somatic Coaching Academy. And I invited her on today because I wanted to lift the fog over the topic of going out on your own in private practice. I talk to a lot of private practitioners who tell me that their decision to go out on their own was very scary. And then I talk to a lot of practitioners who tell me they're seeing 15, 17 patients a day and they make $35,000 a year. And they're always mind blown when I tell them they could see 5 patients a day and make $100,000 a year. And I know, Ani, you know exactly what I'm talking about. So I really wanted to talk with you today because I know that you can shed such light on this topic. And I just love your insight. You're such a brilliant mind. And I'm so grateful I have you today. And I was hoping you would be willing to answer some questions to shed some light on this.
Yeah, you bet. This is really one of my favorite topics.
Awesome. Okay. So my first question that I think will help everyone kind of understand who you are in this light, because you have so many hats you wear. But one of the hats that you wore is being an OT. So how did that journey start for you into wanting to become an OT? Did you work for someone else, or how did that start for you?
Well, I graduated from OT school and my first job was in a hospital setting. And I actually, Samantha, 2 weeks after graduation, I stood in the clinic and I was like, I'm not sure if this is for me. And I couldn't put my finger on necessarily why. Now, 25 years or whatever it is later, I can see I'm not made out for khakis and polos and OT life in the clinic. I'm not a box person. So anyway, my first job was in the hospital setting, and then I got a job with a consulting agency that set me up in different hospital settings. So I was still in the hospital, and OTs have to take continuing education, as a lot of the professions do. And so I started to take continuing education in some energy medicine modalities. And what was interesting to me was that it wasn't really easy to use those modalities where I was working. I was learning them, but I couldn't necessarily use them because maybe they weren't part of a treatment plan, or because my colleagues thought I was weird, even though it really wasn't weird at all, maybe put my hand on somebody and have a conversation with them, but whatever. So I really liked it. I liked the depth of relationships that I could have with my clients. I loved the conversations that we had, and the results were awesome. And so it became very clear to me, again, this was like 2003, I guess, when I started doing this. Feels like such a long time ago. Wow. It became very clear to me that it wasn't necessarily something that I could very openly do at my job in the current settings that I was working in. So I started to conceptualize how I could see clients on the side and make a little bit of extra money.
So that's how it all started, just this little vision of what it would be like.
Yeah, I was kind of frustrated because I did really good work and I couldn't do it at my job. So it just made sense. A lot of the successes that I had in my early career were just because they just made sense to me. And this just made sense. If I can make a few bucks on the side and I can do this outside the clinic, why wouldn't I? I didn't have kids at the time. It just made sense.
So let's fast forward just a little bit on your timeline. So when you decided to make a little extra money, did you automatically decide to do that in a cash-based setting?
No, I was going to take insurances. I knew as an OT that, well, first of all, back then I had to get doctor's orders. I don't think OTs need to do that anymore, but I digress. I had to get doctor's orders. And I knew I had to take insurance. That was the only thing I knew, because that's how it worked in the system. So what I did was I went to Staples or somewhere like that, and I got a prefabbed package of like how to bill patients insurance. I can't even believe they exist. Maybe they don't even exist anymore. I don't know where I found them, Samantha, but I did, because I remember they were red and it was a big package of these like rip off perforated sheets. And so I bought those. I had full intentions of taking insurance and I needed to get doctor's orders. That I put the kibosh on the red
HICVAs.
insurance papers the very first time I went to fill one out with my very first client, no joke, I went to fill it out and I was like, I'm not much for detail. So I was like, there is no way I can do this. I just can't. And so I said to the person, because I literally only had like one person at the time, I'm not going to take insurance. And they said, fine, no problem. I was kind of doing what I felt was a little bit of a specialty thing, by the way, at that point. So for me, again, it just made sense. The clients couldn't get services necessarily anywhere else anyway. So if I was charging cash, well, no skin off their back. It's not like they could have gotten the services elsewhere. I was an occupational therapist doing energy medicine type work with pediatrics, with children. No one around was doing anything like that. So it was a no-brainer for me. I wasn't going to fill out the paperwork. I was just started to charge cash. Now, as you know, I went on and I actually left my job. I developed my own practice and I just kept charging cash because why wouldn't I, right? Like people were paying me. It wasn't a big deal and it was working. And God forbid I didn't want to look at those red papers.
I love that we're just referring to them as the red papers.
The red papers.
That's what I'm going to title this after our talk.
So eventually, actually, I don't know if you know this, but eventually I called the Office of the Professions in New York. It's tough working in New York sometimes because the laws are a big deal. So I called the Office of the Professions. And at that time, I asked if I could do craniosacral therapy, which was the kind of energy medicine I was doing as an occupational therapist. And they told me no. So like legally, I was doing something wrong. So I actually ended up going back to school for massage therapy at the time so that I could legally do the thing I wanted to do with my clients. And at that point, it became a super no-brainer because massage therapists charge cash anyway, right? So now I'm an OT specialized and a massage therapist. And I figured I could just basically do whatever I wanted, which meant just charge cash, not pay attention to insurances anymore.
And at some point in our time working together, we've been together over a year now, right? Yeah. And sometime in our time working together, you said something I never thought you would say, this top secret information. It was something to the effect of, don't tell anyone this, but if I knew you all those years ago, I would have done things differently. So tell me what you meant by that.
Yeah, you're kind of ruining my reputation here. Because I've taken the soapbox for years. So over the past 10 years, I have transitioned out of client care and into helping other practitioners to grow their businesses. So it started out with helping other holistic practitioners to leave the system and grow their holistic business because that's what I did. I do more than that now. But so anyway, when I met you and I saw that you could help people transition out of their day jobs into their own gigs and charge insurance, I thought that was a real win-win for a few reasons. I think it's a win for the client or the patient because they're paying insurance anyway. I think it's always hilarious. I think I've probably said this to you that like insurance is the one thing we pay for and we hope we never have to use.
Yeah, you totally have.
Right. And so I think a lot of people are pissed off about their insurance. Like I pay so much money for my insurance. I never use it. So if I'm going to go see a practitioner, I would like to actually be able to use my insurance as a client. So it's a win for a client. I think it's a win for a practitioner, but not just because they get to charge insurances. Samantha, I think from a mindset perspective, it's a very, very big leap for people to leave the system and go off into their own. I'd be happy to talk to you about all of that another day because it's a really large topic. But the reality is it's a leap. It's a leap to go from getting a paycheck to having to create your own, And so one of the things that helps people to bridge into leaps like that is to take something from the old mindset and be able to anchor in the new reality. And charging insurance is actually a way to be able to do that. So from a mindset perspective, it actually helps a practitioner to transition because they were already in a system where we took insurances and now I'm on my own, but I can rely on the fact that like, I know how that works a little bit, even if it's that I have a biller, right? I know how to
Yeah.
talk to a client about it. And so they can transition. They have that anchor into the old mindset. It helps people to make the leap. It helps them feel safe to make the leap. And from helping people to transition without that anchor for so many years and seeing, a lot of people did it, but also a lot of people struggled. The people who are able to use that anchor and still charge insurance when they go out on their own, even if just partially, it's a really big help.
That's brilliant. I never would have thought about that. See, that's exactly why I wanted to talk to you today, because you make these connections all the time in such a brilliant way that's easy to understand for those that aren't as savvy in the mindset work that you do. But that's brilliant because you're already taking insurance, right? So now it's a matter of getting credentialed with the insurances on your own and all that good stuff. But you're right, it's already doing something you're already comfortable doing, and now you have the freedom to do it yourself. That's really it.
Right. So let's just call this pink elephant out for a second in the room. Like I'm just going to say it, like, don't try to transition and try to do your own billing though, because usually when we work for somebody else, we have somebody else, we're not doing our own billing as a practitioner. And so something clicks in our brains. We're like, I'm going to go out on my own and I'm going to do my own billing. And that's dumb. I'm sorry. It's just a waste of your own time, your precious expertise, your resources. The reason you're leaving the job is so you can have more freedom. And somewhere in our brains, we think, I'll just do my own billing. It's not such a big deal, but it actually is. It's like, why would I go think I can do somebody else's job that like they got trained how to do? Right. And I'm going to go do that. And it's actually going to make my life easier. No, it's not. It's going to make your life more miserable. And just from a mindset perspective, if you leave your day job and you go on your own and you have a biller, then that provides you with that anchor I'm talking about. You have somebody else to lean on. They're doing your billing, especially if there's somebody they can trust like you, because you're the world's best medical biller. But I digress. If we make the leap from going in from the day job into our own thing, but we think we're going to do our own billing, then we don't actually get that anchor that I was talking about, because it becomes more of a burden and we don't know what we're
Yeah.
doing. So I
Yeah,
see
you're totally right.
that is a reason why, like, if we're going to talk about why people fail going out on their own, that's a reason why.
Yeah, and there's probably so many different fears that go with it, but knowing that you can eliminate one so easily is kind of a no-brainer.
Yeah, well, a lot of people think that it's scary to try to pay a medical biller, but what they don't see from the other side, that like we could hold big billboards, but the thing is, some people aren't going to see it, is it's not a cost. You're going to be making more money because you've hired a really good medical biller. See, that's the thing on the other side that people don't know when they're just starting out. But it seems scary, like, oh, I'm going to have to make my own, get my own clients, which is also easy. And then I'm going to have to pay a medical biller. Don't think of it like that. I mean, especially when you hire somebody like you who really knows what they're doing, they actually help you make more money. They help a win-win for you and the client. Like that's their job, is to help you to seal any gaps, because you'll leak money and you'll lose money if you try to do it yourself. So
Yeah, and I've had some of the scariest conversations in my life talking to someone that did exactly that, talking to several people who did exactly that. They left and they thought that was the only way. They thought that was
yeah,
their only option, right? And they didn't want to pay a medical biller, and they come to me, and at that point they've lost thousands of dollars, and they're either angry or they're upset, they're crying, and they don't know how they got to this place, or they do, but as soon as things started to get scary, they just said they can't deal with it. They have to keep working, they have to keep seeing people. The people need their attention and need them to take care of them, and they
right.
couldn't take care of their business anymore. And then I come along and I fix it, but of all that money that was lost, right? Had they just started the right way the first time.
Oh, it blows me away. And I think, from helping you grow your business, been able to see behind your curtain as well, to see your mission is really to help practitioners to close the leaks where they're leaking money. And not all medical billers are going to do that. So I think a healthy skepticism isn't a bad thing. You've got to hire the right person. So do your due diligence and ask questions. If you're going to hire a medical biller, like, how can you help me clean up leaks? Do you think I have leaks? Where would they be? If I was going to have leaks, how would they show up? And like, ask questions like that, because from seeing behind your curtain, because of the way you specifically do things, not just because you're a medical biller, but because of the way you specifically do things, you take it upon yourself to look out for the practitioner. And as a person who's transitioning out of the system into their own thing, we need people who are looking out for our success. We really do.
Yes, so much so. You're totally right. When I see someone, I look at the whole picture and I'm just thinking about how I can help them grow because we're on the journey together. We're a team.
Yeah.
I just recently had taken someone on. We're partnering together now who left an employee setting to go into private practice, and they were very nervous about getting referrals. They didn't know a whole lot about business at all. And now 2 months later, they're flourishing, completely flourishing with a full schedule, and all those skepticisms drifted away because we talked about it. And just like you said, we actually talked about the numbers. She asked questions, I answered them. And we talked about the hard numbers that this is what you're making now, this is what you can make, here's where you were losing money, here's where you can gain money, and all those sorts of things. So it's a really fun topic to talk about with people, and it's even more fun to watch them flourish.
Yeah.
But one last question for you today. It's a loaded question, so please just answer it as best you can. What would you say to, I get this question every single time I work with someone who is in an employee setting and they're going out into private practice and they want to have me as their medical biller in their corner. And their biggest fear, which I always answer this question with your help and your knowledge in the back of my head all the time, telling me exactly the mindset behind it. But what would you tell someone that is nervous about getting referrals? And I'll precurse this a little. I know I love this topic. That one of my newest clients was in a very rural setting, super nervous about getting clients, thought that nobody was going to make the drive, nobody was going to come out to her. And I assured her, with all the work that you've given me inside, now I could express that out, that that's simply not the case. And sure enough, within 2 months, full caseload, flourishing, and no end in sight. Now she's got to try and figure out what to do with people because she has a waiting list. So what would you say?
That's the reality, Samantha, is that you'll leave. And as long as you just tell people what you're doing, you'll have a waiting list. It's actually, especially post COVID here or in COVID or whatever, crazy to think that you won't have referrals. I have also helped practitioners leave who have been in tiny towns. I mean, doesn't matter. Big towns, tiny towns. There are wait lists for every profession. And the thing that people don't realize, like, for example, if you're a physical therapist and you want to leave, there's so much you can do to help people who are struggling with all kinds of things now. People are struggling with their body, they're struggling with their mental health, their kids are struggling, their parents are struggling, and there's wait lists for every practitioner. If you think creatively, and you don't even have to think creatively and you'll have referrals. You just have to whisper in a coffee shop that you're doing your own thing, and somebody could get in to see you in less than 6 weeks and you'll have a line at your door. I mean, that's just the times that we live in. So I really like to encourage people, if they're thinking along those lines, stop using that as an excuse, really, because you could look at any statistic, look at the news, and find that this information is the reality. The reality is there's waiting lists. The reality is that you could have referrals any day of the week. So stop using that as an excuse. If you're nervous or if you don't know what to do to transition or things like that, then say so and ask people who have, or ask people like you, how could I? But don't make an excuse that there might not be referrals out there, because it's just flat out not true.
Yeah, it's crazy to think, but it's just that simple. It's the times we're living in. It really is. Well, thank you so much for being here today. This was amazing, mind blowing as usual to have you. For anyone listening, this is the CEO of New Health and the Director of Operations at the Somatic Coaching Academy. I'm sure I'll be watching one of your videos tomorrow on Facebook Live. I adore all of your videos and your education. I am CEO of TOTLbill Samantha Farina. Thank you so much for joining us. And I hope that this lifted some of the fog off the idea of a private practitioner going into private practice and leaving their employee job setting. I really look forward to working with you all soon. And Ani, I look forward to talking to you soon. Thanks so much for being here.
Thanks so much for having me.